The Philippine Medical Association says more patients are worried about going to hospitals due to COVID-19. A number of them are in need of treatment for their lingering illnesses. The PMA says some patients believe they may contract the virus from other patients in the hospital. As the pandemic lingers on, however, the PMA says these patients will be needing medical attention even more. In fact, it expects more patients will come to see the doctor despite the coronavirus threat. With this, the PMA says the safety of doctors and patients must be a top priority.
GCQ or MACQ will be there for a long time, and we need to be able to continue doing what we are doing. We need to protect our workers, and we need to protect our doctors particularly.
The PMA now urges doctors to impose stricter infectious disease measures in hospitals and clinics. This is how the new normal will look like in health facilities across the country. On top of the list, you must first consult with your doctor online. It's called telemedicine. And if you really need to go to the hospital, the management must limit the number of patients a doctor can see daily. For example, only 5 per clinic. Markings related to physical distancing must also be clearly visible. Frontliners must also wear more comprehensive personal protective equipment and must change their gown for every patient. Enclosed spaces must also be well ventilated to ensure the virus will not linger in these areas.
So we have basic standard operating procedures that we suggested to our doctors so that when they are face-to-face with their patients, they will be able to do their jobs very well without consciously thinking of the fact that they might get the illness as well, and probably baka yung pasyente nila in front of them are asymptomatic carriers. You'll never know.
This ambulant health clinic on V. Luna Avenue in Quezon City has heeded PMA's call. Aside from dialysis treatment, many are now coming to them to undergo rapid antibody testing. The health clinic encourages patients to book a schedule on its Facebook page as much as possible. As soon as the patient arrives at the registration area, his or her temperature is taken. Every booth has a plastic barrier, including the stations for payment and blood extraction. All healthcare and security personnel are wearing PPEs. They will spray your hands with alcohol from time to time. Several safety measure posters are all over the place, as well as physical distancing markings. Frontliners are also disinfecting the area and tools every 15 minutes using either chemical or UV disinfectant wands.
Kung ang isang ospital ay talagang well-prepared, like yung facility namin, prepared kami, wala silang dapat ikatakot kasi even us, syempre takot din naman kami mahawa. So, we will follow all the guidelines and syempre, as part of our service, syempre, we want to protect our clients or our patients na pumapasok dito na hindi rin sila mahawa ng mga may COVID or posibleng may COVID na maaaring pumasok.
While the PMA says there's nothing to worry about visiting hospitals and clinics, it's still best for us to take safety precautions wherever we go and get used to it. After all, they are now part of the new normal. Rex Remitio, CNN Philippines.